hours, we have had a rapidly developing pandemic that has obviously had a tremendous impact on the economy, on people's lives, and has spread throughout the entire U.S. and world. With that, we've been working closely with county, state, and federal authorities that has led to a number of changes, most noticeably today, Governor Wolf shutting down schools across Pennsylvania for the next 2 weeks. In accordance with that, and under the authority granted to the Mayor of the City of Pittsburgh, under the Disease Prevention and Control Law, the Emergency Management Services Code, the Pittsburgh City Code and Home Rule Charter, the Second-Class City Code, the Home Rule Option and Plain Law, and police powers, the Mayor has declared a state of emergency in the City of Pittsburgh. This state of emergency authorizes the Mayor to cancel or limit large gatherings, cancel or limit events or gatherings that require city permits, encourages the use of social distancing to lessen exposure and transmission of the virus, cancel or limit city services, and cancel or limit public and private amenity activities that can further increase exposure or transmission of the disease. It also makes changes under the law to our procedures for procurement and purchasing to allow greater flexibility in the operations of government. This executive order this declaration, it takes effect until it is ratified by City Council and can be extended by 7 days by City Council at any time. With that, to speak further on this and a number of other actions we are taking, I'd like to introduce the Mayor.
Thank you, Dan. Before I even begin, I want to thank you personally for the leadership that you've provided. All of our directors, our chiefs, the people in this hallway and across the hallway. I really do appreciate the fact that we now have a contingency plan in place across all of our departments that will not only keep our workers safe, but will assure the safety of our residents. Today I am declaring a state of emergency and signing an executive order that will prohibit all public gatherings of more than 250 people effective at 9 a.m. Monday morning. We're learning from the rest of the world that taking bold action early can not only stem the growth of this virus, but save untold numbers of lives. You may ask why we're not enforcing earlier. I know that declarations like this can be a shock and they can cause a panic. I want residents of Pittsburgh to be able to plan, especially as many with school-age children are looking at child care needs going into Monday. Others may have events this weekend, and we want to be fair across the board. We don't want to have to cancel a wedding or a bar mitzvah or mass or temple services. And we do have the ability to do this across all sectors, allowing us the ability to make sure that it is implemented. The third is simple logistics. Even with the increase of state police and county police who will be assisting us this weekend to study the occupancy and make sure that restaurants and bars are adhering to the law, we don't have the additional support to shut the city down in a matter of hours. We need 60 hours that we have planned in order to be able to make this effective with proper enforcement beginning Monday morning. We want to address this situation both firmly and fairly for all. The executive order separately prohibits all gatherings of more than 250 people in the city, starting at 9 a.m. March 16th as well. The state of emergency will be for an initial term, as Dan said, of 7 days and be subject to the ratification of City Council, and any extensions will have to go back through Council to continue it. We're allowing workers with school-age children to telework beginning Monday morning, or they can bring their children to work with them. We're working and should have a contract by the end of today to provide them free health care at the City County building and 200 Ross Street so that their children will have a place to be able to stay if they don't want to be with their parent all day. The city is also working with UPMC, Allegheny Health Network, on expanding testing capacity hospital needs, and the support for public safety personnel. We are working with them in order to be able to get the recognition and certification that they need to have testing done in the city of Pittsburgh. So it won't take days, but merely hours, hopefully as soon as next week. We thank our private sector partners for stepping up. The Pittsburgh Water and Sewer Authority has extended its shutoff moratorium until May 31st and waived any income qualification criteria, meaning that water will not be turned off to Pittsburgh residents. The Urban Redevelopment Authority of Pittsburgh extended assistance to Pittsburgh small businesses that will be harmed by this outbreak and offering that assistance to be able to help them beyond the help that they would have from a regular bank. The Housing Authority of the City of Pittsburgh has suspended all evictions except for those with serious public safety implications. Columbia Gas, Duquesne Light, Peoples Gas, Penn America have suspended service shutoffs until at least May 1st. The executive order will suspend all court cases by the Department of Permits, Licenses, and Inspection, Mobility and Infrastructure, and Public Works, except for life safety circumstances. And finally, working with the county executive and the Sports and Exhibition Authority, we are working to have the Home and Garden Show's lease ending effective tomorrow.
Thank you, Mayor. I would like just to spend a few minutes and go over tomorrow's St. Patrick's Day. As the mayor mentioned, we will allow occupancy up to the maximum limit within the bars and restaurants throughout the city of Pittsburgh. However, as I've stated before, there will be strict enforcement of any bar, restaurant, or lounge that is over the occupancy by one person. The bar will be cited, and it will be immediately shut down for the remainder of the day. With the help of council, we've received additional funding for supporting public safety's initiative and the incident at hand. Tomorrow, we will have an abundance of police officers, both uniformed and plain clothes, throughout the downtown, south side, North Shore, Strip District, and other areas of Pittsburgh to enforce the laws. This includes any types of violence, any types of fighting, or any types of drinking and driving. In addition, additional porta-johns, an additional shuttle and hand sanitizer have been placed throughout the south side. The shuttle will remain throughout the afternoon and evening from the 2nd Avenue lot. An extra shuttle, we hope, will alleviate any crowded transportation issues. I must go back to the occupancy. The occupancy being maintained throughout the buildings in Pittsburgh, we ask that, if possible, and the bar owners, restaurant owners would voluntarily cut down the occupancy and ensure that there's equal distance or social distancing throughout the establishment. Some additional things that the Public Safety Department has been working on is, number one, the first responder program throughout the city, which includes a response of either a fire engine or a truck company, will be suspended to less serious calls. They will continue to respond to what we consider E0 calls, which involve serious hemorrhage, severe difficulty breathing, or cardiac arrests. Effective Monday at 9 a.m., there will be a drastic expansion of the Pittsburgh Bureau of Police telephone reporting unit. Many calls that are routed through the 911 center will be routed to the telephone reporting unit. These will include calls that could be handled over the phone, requests for police reports, any type of advice that is able to be provided that will not require the police officer to respond to the scene. However, the police will respond to any complaints or any types of violence calls, as well as accidents with injuries and any type of incident where it's suspected potential violence involved. With the help of Public Works and the Office of Management and Budget, we have acquired additional units to be able to sanitize and decon vehicles. These would include any medic units, police vehicles, or fire units that either personnel or patients or individuals were in there and suspected of carrying the virus. Additional training will be provided in 1-hour sessions to police, fire, and EMS next week on infectious control. The reason for this update is lessons that have been learned over the last several weeks from other communities that have already experienced the virus outbreak. And lastly, the cooperation, as the mayor mentioned, between AHN and UPMC and the County Emergency Services continues to be great. We will have another meeting as early as Monday to discuss if, in fact, we have to consider surge capacity of different hospital and medical facilities and how we will manage that through the county EOC if it is stood up. Right now, over the last day or two, EMS and fire have responded to 1 to 5 individuals that were concerned that they had coronavirus. Those individuals were taken to the appropriate facility, and as far as I know, the testing thus far has been negative. But the individuals were transported with the appropriate precautions by both the fire and EMS units. So I appreciate the assistance from the different departments within the city, our partners with the county, and the medical community. With that, I will turn it back over to Mr. Gilman.
Thank you. I will just add that today, under the leadership of our Chief Operating Officer, Kinsey Casey, every city, single department, and city authority has filed what's known as a COOP, which is a continuity of operations plan with the mayor's office and our Department of Innovation and Performance that identifies every single city employee under an essential or non-essential status, their telework capabilities, as well as backups in case they become ill, going 4 deep for critical positions. So we're prepared to replace the work of any critical employee during any illness, whether it be them or a family member. And also just want to reiterate and clarify something the mayor mentioned, that starting Monday morning for city employees, this only regards to city employees, anyone who is eligible to telecommute and who has a child of school age is welcome to do so, and anyone with a child of school age is welcome to bring that child to work with them. And we are entering into an emergency contract to provide childcare in this building and 200 Ross Street for our city employees to take advantage of as well. Anyone where none of those 3 circumstances works, we are working with on a 1-by-1 basis to make sure they are safe. We are also currently working, literally as we speak, with the school district, nonprofit partners, and our Department of Parks and Recreation to make sure that young people who are out of school are still getting the meals they need in safety during the day while parents are working. We will have more updates on that early next week, as we just have immediately started working on that following the governor's announcement. With that, we're all happy to take any questions.
Today, the president came out with his state of emergency for the United States, and he mentioned this $50 million that it's going to all the states nationally. How do you see that money being used here in Pittsburgh?
That's not clear yet. I literally just hung up about 10 minutes ago with our Washington, D.C. lobbyists who are closely following that announcement, as well as what we hope is eventually a bipartisan compromise bill on coronavirus to see the impacts on Pittsburgh. So far, the dollars that have been released through the CDC have flown to state departments of health and downwards, usually to a county health department. How that directly impacts cities emergency services remains to be seen.
And if this requires council ratification, how does it begin on Monday? Is
Sure.
there going to be an emergency session?
So,
of council?
two pieces of clarification. The executive order and the emergency declaration take effect immediately. They are in place. They took effect when the mayor signed them a few moments ago before we came in. It is the prohibition on events over 250 that takes effect Monday morning. Every other aspect is in effect immediately. Council must ratify it within 7 days, but under the law, it takes effect upon the mayor's signature, and at that point, council can then extend it another 7, but we have the authority under the law to do the first 7 days on mayor's signature.
What allows you to do?
Those were the different, and I can get you a copy of them, all of the different state laws and acts that I
You
listed.
cited earlier.
Correct.
Okay. And what are the penalties if you violate?
Which
What can
piece?
happen, the prohibitions?
On events?
Yes.
I will turn over to Director Historick under his powers as well, but we have the authority to shut the events down. And that is our key. We're not looking to cause harm to additional businesses, but for public safety, we'll shut down events by order of public safety.
Has this ever been done before?
Declarations of emergencies have been done before, certainly, but specifically this type of event, not that we know of.
Wendell, can you talk again, I'm sorry, just about people are going to be struck by, if they call 911, there's a chance that they may not come. I mean, either the fire, there's a prioritization for fire and police. Can you just clarify again what exactly?
Yeah, the telephone reporting unit is actually in existence now. And it is basically, if you call 911 and you're some nonviolent crime, such as something was stolen from your porch, you would be routed to the telephone reporting unit, staffed by a police officer and civilians, and they're able to file the police report and provide it to you, mail it to you, email, etc. We are going to expand that, and you may not have the option. It's basically, we're trying to cut down, number one, as time goes on, our workforce might be limited. As I mentioned before, we're already working in the potential of going to additional hours. The idea is that if we keep the police officers, if we have less staffing, we need to keep the police officers to respond to the violent calls, to the accidents with injuries, to reports of burglaries, reports of robberies, and hopefully the public will understand that some of these reports that can be handled over the phone and sent to them would help us out. And of course, if there's any sense that there's any type of violence that is going to occur, whether it be a domestic, most definitely the police officer will respond.
And regarding paramedic calls, can you talk about that as well?
Well, are you talking about the first responder calls?
Yeah.
Initially, E-zeros are the most serious medical calls in the city. Fire personnel will still respond to assist the medics on those type of calls. However, we are trying to, number one, as I mentioned before, cut back on the responses in case we get inundated with medical emergencies. Number two, on less serious calls, such as is being exhibited by the virus, sore throats, temperatures, fevers, headaches, those type of calls today, you would probably have a fire, whether it's an engine or a truck company with 4 firefighters and the paramedics or EMTs with 2 additional. That's 6 people, and really we only need 2, and cutting it down lessens the chance of more exposures, and that's what we're trying to do here. As we saw in the state of Washington, they have had 20 to 30 firefighters quarantined, and rightfully so, with the incident that they have there in the nursing home. And there's been others throughout the United States, and New York City has also cut back on engines responding with the paramedics unless it's absolutely necessary. Of course, if it involves any type of incident where there's fluids leaking, where there's a potential of a car fire, where there's an accident, the fire unit will still respond. On the medical alarms, individuals that have buttons and the lift assist, where somebody fell down and they're not injured, we will still be relying on the fire to respond to that. But once, again, precautions will be taken if, in fact, symptoms are received, en route. We've met with the Local 1 International Association of Firefighters and went over with them this week of it's necessary that everybody, once you receive any type of information that somebody's exhibiting signs or symptoms, that appropriate PPE must be worn going into there. And we've also, initially, the fire units will send 2 individuals in, an officer and a firefighter, and 2 additional will stay outside. We're just trying to cut down on the exposures of potential patients with the virus.
Do you have any, under the laws that you cited and regulations, is there other room, or do you have the ability, if situation warrants, to extend powers, not just the ones you have here, but others to address, what may be coming?
Dan, answer that. The answer is yes.
Yeah, under the laws I cited, there are very broad powers given to both the mayor and the public safety director under an emergency. These were the steps we believe were necessary right now. If this pandemic reaches new levels, we remain open to amending the order to add additional powers as needed.
Can you tell me what might look like that?
We don't know at the moment. This is changing not just day by day, but hour by hour. And so we are monitoring closely and working with not only public safety, but our hospitals, as well as our lawyers and other levels of government to respond accordingly.
I would say that there's a range, however, and where we are right now would probably be less than the 50% mark. The range would go all the way to full quarantine of the city, where nobody would be permitted outside, something we're not even considering, but in the same sense, something that is under this type of language with a state of emergency that could be warranted to a public safety director.
You have that.
There's a whole range of powers that the state offers under their laws. And again, we have to follow through the procedure. What we were looking at is how can we do our part to flatten the curve. When we look at flattening the curve, it is how do we limit the amount of exposure now so that when we hit peak, our medical community is not understaffed or unable to serve the people who are infected. That also is not limited to our hospitals, although we're working with our hospitals on that. It is our public safety personnel. It is the first responders. If we were to see a sharp increase where 40% of our public safety crews were unable to perform their jobs because they'd been infected, then we didn't do a good job leading up there to protect them from getting infected or in how we were using that personnel. The Emergency Act gives us a broad range of tools to be able to assure the safety of the community, but we're only at this point using what is absolutely critically needed.
The other night you said you all were looking at expanding as neighboring communities might be coming here when the virus is here. Have you all found a place for expansion, for hospital beds?
No, I mean, that's on a continual basis, and there isn't a limit. Let me put it to you that way. We started out by looking simply at city-owned facilities that aren't being utilized at 100%. Which one of those have water? Is the water safe? Which have heat? Which have electric? How many cots do we have? How could we create a place where somebody who is younger, who needs to be quarantined but doesn't necessarily need to be in a hospital could be. We've had conversation with hotels and the idea that maybe we look at having the use of hotels, and then we've had conversations with our hospitals where there's different parts of hospitals within the city that are vacant right now, and what status they're in order to be able to take extra and create extra beds if necessary. Everything that we've gone through, and this is really this entire team. It's not the mayor's office. It's all the directors, the staff members in there, and everything else has been based upon scenario planning. And we've been doing this now for several months. So if the CDC tells us, create a plan in which 33% of your personnel have to work from home, what would that look like? How many laptops do we have? How many of our personnel that could work from home have some way to do their job without necessarily using city equipment? And each of the 3,500 employees over the course of several weeks have been identified in order to be able to pass that scenario. Then you get a scenario, what if 40% of your workforce is infected? And where do you place your public safety personnel? Because you don't want them going back to their children and their spouses. And so working through all these different scenarios has helped us to be able to have a pretty solid plan of what we need to do this week. What we need to do next week, there is not a mayor, a public safety director, or a chief of staff in this world that can tell you. It is so fluid and changing so quickly. We had to come up with a plan today because we didn't have a heads up that the governor was going to cancel, even though we support that decision 150%. All those kids now, we have to find a way to make sure they're getting meals. We have to make sure that they're safe during the days. We have to make sure that their parents don't have to skip work in order to stay home with them and then worry about paying a mortgage. We don't have the luxury of being philosophical about this. This is action planning while happening. So I can tell you where we are this week. I can tell you where we're going to be this weekend. The troops that we know that will be there, the state police, the county police, we know the numbers of where these bars and restaurants need to be, and we'll have our personnel all over the city monitoring. But then on Monday, it's a whole new game because now we have the entire city to look at in making sure that everyone is complying with 250. And then next week we'll have something new, I'm sure.
Can you clarify the powers that the city has this weekend, and then 9 a.m. forward Monday is the limit on gatherings? But what does this declaration mean for this weekend?
It's basically the same, with the exception that buildings in the city of Pittsburgh will be allowed to utilize their occupancy permit up until 9 a.m. Monday morning, when that will change to 250.
Did I understand you correctly that the governor's decision to close schools was a trigger for this?
Well, for the one part of what we're going to do with all the kids in the city, we have over 25,000 children that attend schools within the city, and probably even closer to 30,000 when you factor in the private and parochial schools. So that's about 1 out of every 10 residents of the city of Pittsburgh. And now they're our responsibility to make sure that they're safe on Monday and throughout the next 2 weeks.
Now, can you clarify, Home and Garden Show last day is today?
SEA has been working on this. They are the holder of the lease with the Home and Garden Show. They have been in consultation with both the county executive and myself, and our hope is that they are able to suspend the lease and be able to assure that that today is the last day.
So it's not official yet?
It's not official yet, but it should be official sometime in the next few hours.
Mayor, you briefly touched on it, but where do things stand regarding testing and trying to get more and get more people tested?
Well, let me let Dan talk about that, because he's been talking directly with the hospitals. You know, we're watching as states are now involved. The state of Colorado has created a drive-by testing system, as has the state of New York. We don't have that ability. We don't have a health department within the city, but there is and has been positive conversation.
Yeah, under Director Hisrick's leadership, and thanks to what really has been a tremendous partnership with UPMC and AHN, we are, and the County Health Department, we're aggressively working to be able to announce additional testing. We're not at that point yet, and we need to be very careful about making sure we do it and roll it out in a way that is safe for residents, and following CDC and County Health Department guidelines on who should get tested and when, because again, following their guidelines, certain people going in may not be the safest decision to make. So we are working on that in terms of both providing access to more testing and expediting the results of the test, and we think we'll be able to announce that in the very near future.
Just looking at some questions I'm getting, some people are a little bit confused about the 250. I mean, what does that include? Does that include malls, the casino? How far encompassing does this reach?
It includes all of those things. The only thing that would not really be covered by it is a workplace of a downtown office building, or if you worked at a factory. Those are other laws around OSHA and other federal laws, so it would not address that. But we're talking about shopping malls, movie theaters, arenas, theaters, casino, hotel ballrooms. All of that would be covered by this order. Restaurants, bars, they will all fall 250 or under.
Does that include places of worship, or?
We are working with the places of worship. It is included under the law. We're working very closely with them to make sure people's First Amendment religious rights are protected, but it's done in a safe manner. And I know all of the religious leaders of the city and across the country are trying to do that and suspending certain traditions and practices to allow that to happen, and we'll work closely with them on that.
So a large venue like a casino, is that 250 people in the entire building, or is that in a certain area?
No, it would be any area under one occupancy.
What's that?
So there are certain places that might have multiple occupancies.
This building.
That's separated out, but we are capping occupancy at 250.
So is that like per room?
It depends on each individual structure. There isn't a consistent rule. It depends in zoning with how they're structured.
How is all of this going to be monitored to make sure that these places are doing what they're supposed to do with this occupancy?
Department of Public Safety, obviously, they're incredibly stressed. We are relying on cooperation and a community spirit, but Public Safety will have the authority to enforce it.
Have you spoken to other cities that have taken steps like this?
Yeah. Often. Last two conversations on phone were with Mayor Kenny in Philadelphia and Mayor Walsh in Boston, who just had to cancel the Boston Marathon. And by email and text, mayors from a number of other cities as well. There's a difference between cities. Some cities are the county, and they run the public health department. And then in other cities like Pittsburgh, health is an operation of the federal, state, and county governments. So there isn't a one-size-fits-all approach to this, but there are a lot of agreements on how to flatten the curve, and that is to limit the amount of exposure to people during this week and next week as much as possible. And I think the different examples are really being expressed in Europe, in countries that were proactive before the coronavirus was detected in any large ways, and others that really didn't take proactive steps to limit social engagement. So we try to learn, but it's a very quick class. I mean, it's still going on, and we're still trying to get those lessons. But at that same time, there's scientific evidence that if we limit the accessibility of individuals to large events, we are able to slow the spread. If we're able to slow the spread, the spike will not be as high. And if we're able to flatten that curve, we won't stress our medical providers, both our public safety officials and those in the medical field at the hospitals that we're counting on.
Can you say what the trigger was for you?
Last week. Oh, no. So number one, the weekend where Wuhan was basically under siege, where they started talking about building a hospital and 2 weeks, and they were showing the videos. I had a meeting with the director that Monday and said, we have to start putting together something now. And he took the ball and ran and started putting together preparedness programming. About a few weeks later, the federal government was giving us scenarios, and we started planning, and Dan put together his Delta team with Kinsey and others, and they started working department by department. But being in Washington this week and hearing directly from the CDC officials, they were saying to mayors and local elected officials, SOS, we need your help. it's up to you. This is not getting the attention it needs, and we are going to be in a much worse situation. And our response back is when? And they're today. Today. You need to take action today. And we had medical experts from around the country who were there that were talking with us. And I think that's why on Wednesday you saw how things changed so rapidly. Like, it wasn't just that cities were doing it, but all of a sudden the NBA and the NCAA and National Hockey League, the next day, there were reports that were coming out of the National Institute of Health and the World Health Organization that were coming out like on Thursday, but the information from those reports were already with the experts, and they were sharing them with us, which is there is a way to minimize negative impact, but it requires action right now. Yep.
Mr. Mayor, up until just a little while ago, there wasn't a case in Western Pennsylvania, but I just looked on the health department site. It says there's one in Washington County. What does that change anything that you're thinking about? Is there?
No, we are explained. It is explained to us that we ought to recognize that there are tens of thousands of cases within any MSA in America. We aren't testing that much, and we're only testing when somebody has been in contact with somebody who has it, and so we aren't getting an accurate count at this time. So we operate under the assumption of what medical experts are saying, which is that this virus is following the same trends that it did in Europe. And with those types of numbers, there are expected percentages of people who will be infected, and then expected percentage of those who will die from it. And if we are proactive now before those numbers hit, we're able to lessen the percentage of those that will be infected and thereby reduce the number that will die. And those are the stats we go off of, not the updates of some that are being tested.
In your discussions with other mayors and other leaders, was there any kind of historical precedent or example that helped form a basis or template for preparedness? Anything that was discussed that you can harken back to that helps you move forward?
There wasn't. I mean, there was a short discussion about the Spanish flu, which ironically began in Kansas. But the fact of the matter was, it was a different era. The communication wasn't like it is. The world was at war. Technology and medicine was very different. I think we can look at the AIDS epidemic in Africa. We can look at a couple of the other epidemics that have hit, but rarely have we seen a pandemic that is hitting both north and south of the equator. We're democratized societies and third world countries are facing the same common enemy. You know, I was here during the Snowmageddon, and that was the last time we had to declare a state of emergency. It's a far different situation that we're doing it today than we did back then.
One more.
When you say kids, the kids are now the city's responsibility, making sure they're safe come Monday morning, can you reiterate what you mean by that specifically? I mean,
Yeah.
agree with nonprofits for food, but where?
Yeah, no, so 1 out of every 10 Pittsburghers will find themselves in a very different situation come Monday morning and for the next 2 weeks. And they're our most vulnerable and our youngest residents. They have a system, it's secure and their family is secure, knowing that every morning they're going to school, it's the safest place they'll be that day, and then they come back home. That whole system's now disrupted, and we want to be able to work with our schools. We want to be able to provide food at the schools for kids to be able to continue these 2 weeks with needed nutrition and safety. However, we can't guarantee that that will happen. And in lieu of that not happening, we have to create programs immediately that make sure our kids are being fed, that they're not sitting in an empty house by themselves, that places are being created where they are going to be safe. Just the basic needs. And, you know, that is not something that we do usually during the school year. We have it on the weekends, we have it during the summer, we have after-school programs, but now we have to up our game significantly and be able by Monday to make sure that those kids are being taken care of.
So those are in flux. Those are in flux right now.
We have been working every weekend for, I can't tell you how long. I can't remember the last time that I haven't been on the phone with one of these folks trying to figure out, you know, what needs to be done by Monday. So, and God bless public safety officials. They've been every weekend upping the game in order to be able to get ready for the next week's challenges.
All right, thanks, everybody.
Thank you.
See you again soon.
You going to put these online?
Yeah.
Oh, they're online already.
They are? Okay, they're online, guys, if you want to see the... yeah. Emergency declaration.
It's all in there. It's in the emergency declaration, and it all lists literal.
Have you ever signed an emergency declaration?